Hi, I'm Kelly and I'm here with Karyn, and we are here to answer your grief questions. So, today is a topic that I think a lot of people can relate to, and something I don't think we've actually really addressed yet, but probably
I
really
know.
important too.
Yeah.
The question is, what are some specific grief challenges related to caregivers?
Yeah. So I think we've probably talked about caregivers, but not this specific. And something came up as I told you yesterday. It made me think about it. And I think there's a lot, as we know. The first is probably going to be with loss. There's the loss of the person, but there's also the loss of role and identity, and a person's schedule and their routine, and all of those things that have been changed and put aside. I mean, caregivers change the way they eat and sleep, and whether they're going to the dentist or not, all the things that they
Exactly.
need to take care of for themselves. And it's just this abrupt, I mean, even if it was following a long-term illness, it's still this kind of abrupt change. And if there's support coming in and out of the house, I used to work for hospice, and people would say, like, how hard an adjustment that was to have all these people in your house, the nurses, the aides, the social worker, people delivering equipment, things like that. And then all of a sudden there's nobody. I mean, nobody there. And the adjustments that caregivers have to make, and that's for somebody who had it in the home. But if you had a loved one in a facility, your day revolved maybe around going to visit them, or your weekends, things like that. So there's that, which is the identity, the role, the schedule, things like that. I think there's also the emotional piece of kind of looking back and thinking about all the decisions that you had to make, all of the different scenarios that you were put in, probably the fact that you really didn't even get to process what was happening as it was happening, because it's just about the next appointment, the next dosage, whatever it may be. You're just so in and so on, and everything is always about the other person, that you're not really getting to stop and think about how you feel and how hard this is. And with that, I think is some turmoil at some point. Being a caregiver can be exhausting and frustrating, and there's so much fear and uncertainty and all of that. And so I think sometimes people feel like they didn't always handle things as well as they could have, or that they weren't the best version of themselves. And they'll think back to times that I wasn't as nice or as patient as I could have been, and now their loved one's gone and they feel awful. So, I mean, there's a lot. I'll pause because I know you have thoughts too.
Well, I mean, honestly, Karen, you're bringing up some stuff for me.
Yeah.
I'll be honest, and I'm going to tell you a funny little story, but somebody that has some intuitive mediumship abilities recently gave me some advice and said, your dad understands that when you were trying to get him out of bed and you weren't always the most patient with him and you were telling him what he needed to do, that you were just really trying to help him, and he's not upset with you for that. And I
Oh,
think I really needed to hear that, because like I did, right? As this, you're in this position, you want to help them. Well, dad, if you just eat, you just get up, you have to be walking, you have to do all these things. Like, that was my like denial that he was dying, right?
mm,
And now I can look back and see what was happening during that period of time with him, but I don't think I wanted to admit it.
sure.
So I felt like if I had to keep pushing, if he just gets out of bed, he's going to be okay, right? That was my way to feel like I was doing something, but it wasn't always the best version of myself. So,
Yeah. Well, and it's like, what's the alternative? Is that you just sit back and be like, okay, yeah, we don't know what else to do but to try and provide hope and try to provide encouragement. It's very difficult. There probably is some maybe very perfect balance somewhere. I don't know anybody that's been able to achieve it. I don't even know how you could do that, between trying to let them be where they're at, but trying to get them to where they want to be, and where they need to be or could be. And you don't know what the outcome is, because some people maybe are going to recover, they are going to get a little bit better, they are going to have more time. And so we don't know until after when that time's going to be. And so it's just so hard to judge what a person is capable of. Also, what if they're giving up hope a little bit? What if they're not trying as much and you feel like you have to be in that role to kind of push them a little bit? So, I mean, and I think behind all of it again is just the fear, the uncertainty, the pressure. I mean, and a caregiver has to be making so many decisions, probably none of which ever feel like the right one, which is hard. The other thing too, I mean, we're used to people in our lives kind of playing an equal role, whether it's parent and child or, husband and wife. Like, we are kind of in this together, and you do this and I do this. And suddenly you're doing everything. And this person can't take care of you and can't really be there for you. And you kind of feel, even though you understand sometimes, Mary, put upon, and it feels like a lot to have to do, even for someone that you love so much. So there's that part of it too. So I know there was one other issue that we had talked about. What had you mentioned before?
Well, feeling guilty that you feel some relief when the person does die.
Yeah.
Because especially if you're in that caregiver role, it's exhausting. I don't think anybody understands how exhausting it is until you go through it, especially depending on the level of care the person needs. I was talking with a caregiver this week, and, having to change his diaper and clean up and do all of that. She's like, I didn't sign up for this. Like, this is not, I'm not good at this. And so when then they do die, there is a bit of relief, because it's a lot. It's exhausting. And I think it's a very normal, natural feeling to have relief, but then you feel guilty for having that relief.
Absolutely. Well, because our brain makes the connection that, I feel relieved, and I'm relieved because this person is not here, and therefore I'm relieved that they're not here. But that's not it. It's just, and I try to talk to people about that. I'm like, think about any other really stressful, challenging time in your life, whether it's like this really awful time at work or some awful time in a relationship or something. And you just, or you're really ill, you just want it to be over. I don't want this stress to continue, and I just want this whole thing to be over with. And that's like really justified and valid in all other parts of life. But for this, suddenly we're not supposed to feel that way, or we think we're not supposed to feel that way. But it makes so much sense that you would. And it's not because you're glad that they're not here. It's just momentarily. Because the other thing I will tell you, I don't think that relief is terribly long lasting. But even for the moment that a person has it, they can feel really terrible. But that's not usually too much of a long-term feeling, for most. So
some it could be, some, and I think the reality is grief is so many different emotions at once.
Well,
we can still have tremendous sadness that they're gone, but also feel relief that we're not having to do those caregiving tasks anymore.
Yes. And making space for both of them is probably what is the most important thing to do. And the other thing I try to remind people, like going back to where we feel like we weren't the best version of ourselves. I think, there's a tendency after loss to get like very hyper focused on this one time, which is, their illness or, their passing. We have a whole life with a person, and then it was this part, and this is the part where I messed up, and this was the part that I wasn't my best self, and this is the part where I fell short or I could have done better, as opposed to looking at a lifetime of caring for a person, loving a person, hopefully being the version of ourselves we want to be. So I hope that that's something we're able to do, is kind of open up that window and let more memories in, not just the times where we feel like we didn't do our best. But it's not an easy thing to do right away. It takes some time for sure.
Definitely.
Yeah.
Well, thanks, Karyn. And I just want to remind everybody that is in that caregiving role to just make sure you're taking care of yourself. It is really important to prioritize your health and mental health and well-being as well. Make sure you're going to some doctors and making sure you're taking care of yourself. And if you are beating yourself up about feeling that relief, just going back to that self-compassion that we've talked about so many different times already, and just being kind to yourself. And thinking about what would you say to a best friend, and give yourself that same advice.
Yeah, for sure. Yeah. Thanks, Kelly.
Thanks for watching, and stay tuned for more some questions on grief and loss from myself and Karyn. Take care.